hear me? How are you?
Hi, yes,
Okay.
I can hear
All
you.
right.
I am good.
Okay.
Just trying
Yeah,
to wrap
great.
up
Thanks for
Friday.
joining. And I just wanted
Yes,
our listeners and viewers to know a little bit more about you. And you've done so much. And I'm so delighted to have you here today to talk to me about menstrual pain in young girls. So tell us a little bit about yourself. And then I know you're in California, so tell us a little bit about what you do. And yeah.
yes. Yeah, awesome. Thank you so much for having me on, and hi to everybody who's watching. So I am Dr. Prabakar. I'm an OBGYN, and after my training, I did a I did a 2-year fellowship in minimally invasive surgery, which is where I focused on learning surgical techniques, just robotic surgery and stuff like that. At this point in my career, I don't do as much OB, so I don't do as many deliveries and things like that. I really focused on gynecology, and I take care of GYN issues for uh, all women through all stages of life. So my youngest patient is 11,
Hmm.
and my oldest is like 82. And I have a niche in fibroids,
Hmm.
which that's why my name is the Fibroid Doc. So I take care of a lot of women with heavy bleeding, pelvic pain, fibroids, and I'm in the Bay Area, and I just opened up my own practice last year. So yeah, I'm out here in Lafayette, California, and yeah, excited to be here and answer questions
Okay, great. So
for you
yeah,
all.
and for the viewers, if anyone has any questions, please feel free to put them in the chat, and I will ask Dr. Prabhakar as well. But I guess the first question I had for you, and why I'm interested in this as well, is because I treat a lot of young girls with menstrual concerns and menstrual issues, from a whole host of just not having their period at all to just having very, very painful periods. And one of the most common questions I get is, what does what's abnormal for a heavy period? So, when a girl, and I treat, girls when before they start having their period all the way till they're 22. And so at what point would you say something is abnormal, or the period pain is abnormal that needs an evaluation?
Yeah, that's a good question. So, for most women and young girls, there's the period flow is going to fluctuate. So usually the first day is a little bit light, then day 2 and 3 tend to be heavy, and then day 4, 5, maybe 6 are light again and a little spotting. So that's sort of the natural way the period typically flows. Now, and so anywhere from 4 to 5 days. So for women or young girls who say, "Oh, I think my period is really, really heavy," is when they're bleeding more than 7 days. They're bleeding
Mm-hmm.
7, 10 days, and instead of those 2 or 3 heavy days, now they're having, day of spotting, and then 5 days of heavy, heavy bleeding, and then 2 days of spotting. So that tends to be a lot. And also, how heavy is heavy? So if you are changing, on those heavy days, a lot of times you're probably changing about 4 pads a day and then using, one at night. But if you're ever getting to a point where you're changing
Mm-hmm.
pads every couple of hours, then that's too heavy. And I think a very important thing to remember is when you first get your period,
Mm-hmm.
it can sort of be a little bit all over the place. Like, it's not going to fall into a perfect pattern right away. And I think I see a lot of young girls get all concerned, and moms getting very concerned about that. So one of the things I suggest is really having a diary, writing, okay, this month, when did my period start?
Mm-hmm.
When did it stop? What are my symptoms? And so on and so forth. And if you really start to see a pattern over 6 months, then it becomes, then I would seek some treatment. And you also asked about pain. Now, it is common to have some cramping, some pain, and they usually should be taken care of with a
Mm-hmm.
Tylenol or a Motrin or Advil or Aleve. So some girls will
Mm-hmm.
have to take maybe up to even 2 or 3 a day on those heavy days, and that's fine. But you should be able to still do your things, go to school and play sports and, go to tennis practice and whatever. But if it's getting to a point where, oh, it's
Mm-hmm.
debilitating, like I'm gonna have to call out from school every those 3 days every single month, then that's a problem, and
Okay.
that's
Okay.
when you should seek
Okay.
help.
And so, so I have some questions about, the pain. And so, some of the viewers are saying, okay, I had pain, my daughter has pain 10 out of 10 and is missing school, the week that she has her period, missing school. Is there something, non-medical that they can do besides, Advil? And over what period of time? I think you said it's over 6 months that continues to have them be evaluated. Is that right?
Yes, I think in the beginning, especially around 11, 12, when young girls first get their period, it is their body's still getting used to it. The axis in the brain is still getting
Mm-hmm.
used to all of this. And so it can be a little more painful in the beginning,
Mm-hmm.
it can be a little more heavy, it can be a little more
Mm-hmm.
erratic, and we're not having
Mm-hmm.
this perfect flow and rhythm. So yeah, I think it's important to get some data and then go to your doctor. Now, if month two you're just floored
Yeah.
and you're getting pain every single day. I recently had a patient like this where you're getting pain every single day and you can't even function normally. Well, that's not normal and you should seek care sooner. But if it's just an issue, if it's an issue of heavy bleeding and pain, and you're not really sure, well, is this normal or not? I would get some data first, and that's a lot more. You can get a lot more out of your visit with your
Okay.
doctor then.
Okay. Um, and
Yeah.
so can you define for us,
Yeah.
fibroid? Like what is, I know your clinic is called the Fibroid Doc and that's your specialty. So I wanted to find out a little bit from you. If you could explain to our viewers, what is a fibroid? I mean, it sounds very scary when you hear that diagnosis. And the second part of that question is how common is it for younger girls to have fibroids?
hmm Yeah, so fibroids are little balls of smooth muscle that grow on your uterus. So the uterus is made up of smooth muscle, and fibroids kind of grow on your uterus. They can be the inside the cavity, they can be in the wall of the
Mm-hmm.
uterus, or they can even grow on the outside. And 99.999% they are benign. So
Mm-hmm.
especially in young girls and teens. So and often you don't even need to do anything about it. So a lot of times the way young girls will know is if they feel like, oh, I'm pressing around my belly and I feel like a little ball. I'm
Mm-hmm.
feeling something every time I turn around. Or again, after 6 months your bleeding is still really really heavy, then your doctor may do an ultrasound to check for fibroids. Now, it's pretty rare to actually get fibroids in
Okay.
teens, and more younger teens. Um, in the incidence of fibroids is about
Oh, wow.
80% in the
Okay.
US population. So that's a lot by the time by the time you
Okay.
reach 50 though. So it can start definitely in your 20s, early 20s. I've also seen it late teens, 18,
Mm-hmm.
19. Way more unlikely to be starting at 12 or 13, but that should definitely be something that your doctor's thinking about, that you should be thinking about. Oh, I wonder if it's because of a
Okay.
fibroid.
Okay. And so if a
Yeah.
mom has,
And was there another
so yeah,
part
so
to your
I guess if
question?
a mom has a fibroid, the question always comes up as, what is the risk for my daughter getting a fibroid? Is this something that's genetic or why does it happen?
Yeah. Fibroids can be
Mm-hmm.
genetic, but are not always, but often are. So if your mom, grandmother had a fibroid, yes, there's a high chance that you could also get a
Mm-hmm.
fibroid. That's something you should be thinking about. But I think it's about, probably 10 to 20%. And it doesn't mean that just because you have it, you're going to have it, but it's something that you want to mention to your doctor. Also, some patients will say, oh, my mom got a hysterectomy at a young age. My
Mm-hmm.
grandmother got a hysterectomy, which is removal of the uterus, or my aunt got a hysterectomy, but they don't know why. So if you have such a history, it is worth digging
Mm-hmm.
into it a
Okay.
little bit.
And so are there, treatment options? So say a young girl, say there's 18, 19-year-old that has, severe pain and she does, feel that there's, maybe a fibroid or there's ultrasound that detects that there's a fibroid there. At what point would you do anything for it? Or when do you say, okay, there's surgery, or are there non-surgical options? And when would you go that route?
Yeah, so it all depends on what
Mm-hmm.
symptoms the fibroid is causing. So when we scan a young woman, sometimes we find out, oh yeah, you have fibroid, but the patient
Mm-hmm.
says, oh, I didn't even know I had a fibroid. I don't feel
Mm-hmm.
anything. My periods are perfectly
Mm-hmm.
normal. Then you don't have to do anything. If bleeding is the number one symptom and that's the number one concern, then there are lots of hormonal medications to take to help suppress that and to help control the bleeding. And this is particularly helpful in young girls who are on sports teams. So I see a lot of moms and young teens who are like, oh yeah, I'm swimming and I'm playing tennis and I'm traveling all the time for sports and teams and I can't have this. Like
Mm-hmm.
I can't be out for, 7 days and all that. So for those patients, it's ideal to go on something as simple as a birth control pill just to help
Yeah.
those symptoms temporarily. And now that doesn't mean you need to be
Right.
on it forever, right?
Right.
You can always go
Right.
off of it after
Right.
6 months and see how things are. Um, I don't really recommend surgical treatment unless it is really big, it's really pushing on your abdomen. You can really feel it. It's causing pain. Um, and at that point, we would look into surgery. And it's very rare that we have to operate on a teen for fibroids. I think the youngest time I see it really become a
Okay.
problem is around like
Okay.
22, 23.
And so, taking a step back from fibroids, so what are other causes? We talked a little bit about menstrual pain in the beginning, like teens are not really used to having, painful periods. And then we talked about fibroids. Are there other causes of pain with periods? And are there other things that we can do?
Yeah, so the other big one that needs to
Mm-hmm.
be thought about is also endometriosis. So endometriosis and adenomyosis they're rare in such young girls, but they can definitely happen,
No.
and as young
Okay.
as 10, 11. So this is where, this is a condition where the glands of the uterine lining leave the uterus and go and implant on other parts of the pelvis, like the ovaries and the bowel, and
Uh-huh.
just scatter on the pelvis. So when you get your period, it's just not your
Okay.
uterus that is kind of contracting and getting this pain. It's all these other implants around your pelvis. And so that
Mm-hmm.
can be extremely painful. Now, an MRI is a good test to look for, endometriosis or adenomyosis. Adenomyosis is kind of severe endometriosis, and there is a condition of juvenile adenomyosis. So this is something that also needs to be thought about. And, seeing a pediatrician is great as a first step, but then really seeing a gynecologist who specializes in endometriosis is crucial, because for a lot of young girls, this diagnosis is delayed and they see a lot of doctors before this diagnosis is made. So if that truly is the case, you have endometriosis, there are, again, lots of options from medication to surgery, where you
Okay.
remove the endometriotic implants, so the girl can have,
Okay.
not have so much pain.
Okay. And so is that a condition that is more genetic? I mean, why would a girl develop endometriosis, especially somebody at a younger age?
Yeah. For both these conditions, for endometriosis and
Mm-hmm.
fibroids, we wish we knew like
Mm-hmm.
what caused them, but the truth is we don't. For endometriosis, it's a 10% chance if your mom has endometriosis, 10% chance that you're going to get it. So again, family history is really important. But yeah, people have
Mm-hmm.
there are genes that are being looked at, there are lifestyle factors that are being looked at, but clearly in somebody who's 10 or 11, what have they done so far that's going to cause something like this? So we don't really know. There's a lot of research being done. It is frustrating that we don't know, because it's such a impacts our quality of life so much. But yeah, we'll have to stay tuned for what really causes it. But one thing that we can do to help, regardless, with the heavy bleeding, with pain with fibroids, with pain with endometriosis, is really trying to live a healthy lifestyle. And I'm sure this is something that you talk,
Right.
about with your patients, but trying to eat nutritious foods, trying to get that exercise in, even if it's a walk, all of those have shown to
Mm-hmm.
positively affect, pain. And there's a question earlier about, well, what do I do if I don't want to take Motrin or Advil or Tylenol? A
Mm-hmm.
heating blanket can really help. Applying creams such as sometimes even Bengay or Aspirin cream
Mm-hmm.
or Tiger Balm, things like that to help soothe the areas. CBD cream, no THC, but just regular CBD cream can also help just kind of
Okay.
relieve pain.
And so it sounds like,
Yeah.
those are the big three. It's sort of just, beginning your cycle, sort of getting used to the cycle, and having your uterus get used to the period, the pain, and then maybe fibroids or endometriosis. And really, it sounds like the goal is to track the periods, really to see how they are, and, at least to have, a six month time period. Is that the message that you usually say? Yeah.
Yes. Yeah, yeah. I think, 4 to 6 months, just so when you go into your doctor, you can have some sort of data and seeing, what your body is doing. The one other thing I will also say is ovarian
hmm
cysts can also cause pelvic pain, and that we can also see that in young girls. And usually these are just benign cysts filled with water or fluid that will often just burst and go away on their own, but sometimes they can get really big and can cause pain. So again,
Okay.
an
Yeah. And I just
ultrasound
wanted to
will
make
pick
a
that up.
comment since you mentioned ovarian cysts, and I wanted to have you comment on that, since you're an OBGYN. But how common is it for girls to have ovarian cysts? Because I have some girls who come and they say they've had ultrasounds done, and then they have cysts on their ovaries, or they have, multiple cysts on the ovaries. And how often is that you see that as a gynecologist when you're looking at ultrasounds?
Yeah, we see it often. I mean,
Yeah.
everybody has cysts on their ovaries, right? It's the little follicles that have your eggs. And so a lot of
hmm
teens also have PCOS. And so the ultrasound finding may actually show a lot of cysts, but it's not like cysts that are problematic. It's cysts from PCOS. When we talk about larger cysts, those are much more rare, but those are the ones that are really going to cause um,
hmm
pain. So it is pretty rare to have a cyst that's 6 or 7 or 8 centimeters in a teen girl. But if you suddenly have acute pain where you're like vomiting, you're just doubled over, then it's always something to think about. But because when you have those larger cysts, they can also
Yeah.
twist on themselves and cause torsion, which is an emergency. So, yeah.
So if a girl was to be at risk for that, that would cause like severe pain and nausea, vomiting. Is that what you're saying?
Exactly. Often nausea, severe pain, it was totally fine. And boom, now I went for a
Okay.
run and now I have extreme pain. Or I was just sleeping and I was turning around and then I have extreme pain. And that means that
Yeah.
cyst, it's like a water balloon, twisting
Okay.
on
Okay.
its top. Yeah.
Okay. Yeah, this has been super helpful. I'll open it up for questions if anybody has any questions, at least from the viewers, and see if anybody has any questions for Dr. Prabhakar. But I think this is very important because this is, I have a teen daughter myself, and there's always questions about what's normal and what's not normal as far as the periods, not just, with regards to pain, but also with regards to the cycle length as well. But I think, I wanted to have you talk a little bit about the
Hmm.
pain because I think most people, tell me, oh, my teen has so much pain with their period. And so I think it's important to know what's normal and what's not normal and what are the signs that need evaluation.
Yes. Yes, and everyone has a different
Right.
pain threshold too, right? So, when I think about back to when I was a teen, I was like, oh man, I did have to, I had
Right.
to take some Advil every time, for a couple of days. But I was still able to do everything else I needed to. And I think, especially as a teen, I think it's more important to keep your routine, have as much of a normal schedule as possible, even if you have your period. So I think it's always beneficial not to suffer with pain just because
Right.
you don't want to take an Advil or a Motrin. I would just try to feel better and keep doing the things you're doing so you don't feel more isolated during that time, because that's what a lot of young teens also tell me, that they're always having to call out, and then they really feel isolated. Their friends are wondering why they're
Yeah.
not there. They're missing out on things, right? So trying to keep up a normal
Right.
lifestyle,
Right.
I think, is
Okay,
important.
great. Well, it looks like we don't have any questions, but can you tell us a little bit about where people can find you, and you give us information
Yes.
either online or on the phone, like where people can find your information.
Yeah. Yes. So for anybody in the Bay Area who wants, to come and see me, it's lamorinda.gyn.com. That's my website, lamorinda.gyn.com. And for anybody with fibroids, who, just wants more information from an expert, I'm happy to, do a coaching session. This is especially helpful for patients who are not in California. I'm certified, I'm licensed in California, but if you're somewhere else in the country or the world, I can't technically see you as a patient, but I could spend an hour just doing fibroid coaching where we're talking about, fibroids, treatment options, and all of that. So you can access that through my other website, thefibroiddoc.com.
Thank you so much. This has been super helpful and it's been great.
Thank
and
you.
Enjoy your Friday. It's Friday afternoon here, but enjoy your time. And thanks so much for joining me today.
Yes, thank you so much.